Thank you, Mr. Chairman. Director Vought, thank you for coming before the committee today. In the fiscal year 2020 budget, your office has outlined a plan to invest in important programs that are central to many Americans, while also reducing our discretionary spending and reducing the growth of mandatory spending. I am concerned about our nation's rising debt, and I do appreciate the fact that the President is putting us on a plan that moves us toward fiscal responsibility by decreasing spending on non-defense discretionary programs by 5% next year, as well as reducing mandatory spending growth through reforms targeted at waste, fraud, and abuse, and lowering drug prices, and as well as welfare reform. Our federal revenue growth projected for 2020 is 4.9%. Does that number ring true with you? 4.9%. Yes. Most states in our country would love to have that sort of revenue growth. The only ones that probably have it would occur after a sizable tax increase. 4.9% revenue growth is very strong. Of course, our problem is that our spending levels are quite a bit higher than that. Would you say it is accurate that during the previous administration, President Obama presidency, that our national debt went from $9.5 trillion to $19.5 trillion in an 8-year period?
Sounds about right.
Sounds about right. Can you quantify the general impact of the Affordable Care Act on our current mandatory spending levels? I think it's roughly, well, why don't you answer first, please?
Sure. It's a sizable aspect of our mandatory programs, healthcare expenditures in general, from Medicare to Medicaid to the Affordable Care Act's expansions of Medicaid and their exchange premiums collectively absorb a very large portion of the mandatory side.
Right. And in spite of there being various taxes that went along with the Affordable Care Act, would it be fair to say that our current deficit has approximately $300 billion to $400 billion in it due to the Affordable Care Act, increasing the debt by as much as $300 to $400 billion this current year or in 2020?
I haven't looked at those numbers recently, but I take your word for it.
My colleagues on the other side of the dais argue that this year's projected deficit is grown by the enactment of the 2017 Tax Cuts and Jobs Act. My understanding is that this does add to the deficit, but approximately $150 billion. Is that about accurate?
The Affordable Care Act certainly did not help us from a federal spending trajectory. I would certainly agree with that.
Right. Okay. But the tax cuts, the deficit, current deficit, the tax cuts have attributed to approximately, in current year or in the next fiscal year, about $150 billion. Closing rapidly, but $150 billion.
Yes, that's about right.
Okay. And then since the enactment of the tax cut bill, we have had 3 million private sector jobs created. What would you say the estimate of the of these jobs? Would you say that perhaps 2/3 or better have received employer-based health care?
That would be my assumption. 5 million new jobs have been created since this administration took office. Many of these, given the fact that we have employer-provided health care in this country, would receive incredible health care as a result. And I would certainly think that that's an intuitive assumption from that.
So, just doing some easy math on that, that would add up taking people not just off of the unemployment rolls, but also providing them health care. I mean, that could add up to $50, $60 billion right there.
Perhaps.
Okay.